Good morning, good afternoon, everybody. I'm Erin Michalak. I'm the founder of the collaborative research team to study psychosocial issues in bipolar disorder. And it is my real pleasure to welcome you to our 15th, can you believe it, 15th talkBD live event. This one is entitled Pregnancy, Postpartum and Bipolar Disorder. I'm joining you from Huesam, Roberts Creek, which is located in beautiful British Columbia. It's baking hot today on the traditional and unceded territories of the Coast Salish peoples. It is an honor for me to live here. And I'm really excited to be able to tell you a little bit about our session today. It's wonderful to see the people on the line with these events, which we've been holding for a year and a half now. We have some constant companions, people who make it to almost all of these webinars. And then as we're starting to get into more specific focal areas, we see new participants, and that's just wonderful to see that we're reaching into new communities. If you haven't joined one of these events before, they work pretty simply. They're really not designed to be full of PowerPoint slides. We will talk about science, but we're really trying to create a space that feels safe and welcoming for a conversation about various topics in bipolar disorder. We will be sharing a resources document with you through the chat in Zoom, if that's how you're joining, that details all of the resources that we're covering in this event, and then there'll be a few slides at the end as well. Regarding the questions and answers, you can do those in a number of ways. If you're on Facebook, you can drop them into Facebook. If you're on Zoom, you can put them in the Q&A box. Welcome to our participants in Calgary. Wonderful to have you here. Please do drop into the chat and get the conversation going to let us know where you're joining us from today. And yeah, so I think that was it mostly for the housekeeping stuff. Just to finish off with the questions and answers. We don't take them by audio, so we'll just do them by text. Laura is working hard behind the scenes, coordinating all of the questions. And thank you also to everybody who's popped questions before this event into our survey form on our CREST-BD website. There's already some fantastic questions that have come in, and we'll be handling those at the end. So presuming I didn't miss anything really important, I think it's time for us to get into some introductions. So with that, I will pass over to Catriona and Keri. Welcome.
Thanks so much, Erin, and thanks to everyone who's joining us today. It's a real pleasure to be here. My name is Dr. Catriona Hippman. I trained at UBC as a genetic counselor and then practiced in the area of psychiatric genetic counseling for a number of years before returning to UBC to do my PhD. And in that, I focused on how to better support women and individuals who are deciding about taking medications in pregnancy. And I graduated last summer, Zoomed events in the pandemic. And since then, I've been working as a research fellow with the Reproductive Mental Health and Infant Psychiatry programs at BC Children's Hospital. And I also like to include in my introduction that you can obviously see that I'm white, but also that I am a settler and a heterosexual mother of two young boys. So I also bring that perspective with me as well. And I really appreciate Erin's introduction, acknowledging the land we're on. And I am also here in British Columbia. I'm in my home in Vancouver, and so on the territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and very grateful to be here. I'll pass it over to Keri.
Hi, so my name is Keri Guelke, also a settler here on the unceded lands of the Squamish, Tsleil-Waututh, and Musqueam nations. And I am a mother to twin 8-year-old identical boys. And I'm actually quite involved with the Indigenous community, and my boys attended an Indigenous school for a couple of years, and working hard to make changes. I'll just give you a bit of a history of my bipolar diagnosis. I was 16 when I was first diagnosed and hospitalized, and back then it was called manic depression. I've had 5 episodes in my life, 3 hospitalizations, and yeah, I guess I should say what I'm doing currently now is I work for Vancouver Coastal Health as an outreach worker, which I do mostly on my bicycle. And I also just graduated from a master's program in public policy. Should I just go straight into my pregnancy?
Well, let's take a pause for some congratulations to both of you first. Well done. And then one question from me. You both talked a lot about your children and about the school that you've been doing. Just give us one tip for something you've done in the last year and a half just for you. One of the things that you've done for self-care just for you. We'd love to hear those tips during these events too.
Oh, that's a really good point, Erin. Thank you. And big fan of trying to remember to prioritize taking care of ourselves. For me, I have been a tap dancer since I was 3 years old, and I am delighted that the tap studio that I am with found a way to continue that during the pandemic. I've been doing tap by live stream. I bought a little tap floor that I put down and in my son's bedroom, and get it all set up with my laptop and do my tap class. And we'll be able to do some tapping in the park actually in the summer. So yeah, that is always really good for my mental health.
Goodness, I need to connect with you because I used to compete in tap dance. And I've always wanted to get back into it. I danced at Showboat when I was 12.
Oh my gosh, that's amazing.
What I used to do for my my mental health and self-care was play soccer, but sadly I haven't been able to play with the pandemic. But I meet with some of my closest friends every Saturday morning for coffee. So that's been pretty good for me.
Thank you both. Amazing that you had that connection without realizing it, even though you know each other. Keri, we would love to hear some more about where you've been and where you are now and your story.
So now, I guess, should I talk about the pregnancy piece then now? Yeah, okay. So one thing bipolar does get in the way of is family planning, and my episodes definitely delayed meeting a partner. So I met my partner late in life. I was 39 when I met him, and 6 months later I was hospitalized at St. Paul's on his birthday. I stood him up, but and then a year later I was hospitalized again. So I'm already getting on, and I'd always known that I really wanted a family. And that was a conversation we also had like right when we started dating. So yeah, that definitely delayed having children. And of course he was a little uncertain after those 2 hospitalizations. So by the time I was stable and we wanted to try and make it happen, it was really difficult. So we ended up going through the IVF process. And I'm lucky to say we were successful. And yeah, my partner was very supportive. So because of my bipolar history, I was referred to a reproductive specialist at BC Women's. And at this point, I'd been so stable that I actually wasn't on medication. And the psychiatrist really urged me to get onto medications during my pregnancy. And that for me was not a very positive experience, because it felt like there was a lot of fear involved in getting me to make that decision. I was told that, 50%, some doctors think there's a 50% chance there'll be an episode immediately following birth. Some doctors think there's a 100% chance. I later learned that her own experience of patients that weren't on meds was 50%. But it did, and I do think she was coming from a good place. I think she wanted me to have a successful, safe pregnancy. And because of that interaction, it did make me have more supports in place during my pregnancy and following. And she also arranged for me to be in hospital a little longer for observation. So I'm happy to say, though, there was no episode following birth. And I also, I think I did mention I was lucky to have twins, so 2 and 1. So that was a nice experience for me, or lucky.
Thanks so much for sharing your story with us, Keri. And I am sorry that your experience with the reproductive mental health program wasn't 100% positive. But I am glad that you had so many supports in place and that you ended up with no episodes in the postpartum. And I think if there's one thing that we want you to take away from this event today, is that it is possible to have bipolar disorder and to have a mentally healthy pregnancy and postpartum. And there are lots of different ways that you can do that. And, as you've heard from Keri, that it is even possible to do that without medication if that's what's right for you. And so I wanted to share a little bit more about what we know from research. We know that there is an increased chance of having episodes in the postpartum if you have bipolar disorder. And so there's research suggesting that there's maybe a 25 to 50% chance of postpartum depression, which means that there's a 50 to 75% chance that you wouldn't have postpartum depression. And then there's some research to say that there's about a 30% chance of having postpartum psychosis. And that means that there's about a 70% chance not to have an episode of postpartum psychosis. And just to elaborate a little bit on what those are, I'd imagine, if you have a diagnosis of bipolar disorder, then you're familiar with depression. So I won't go into that in very much detail, but postpartum psychosis, maybe not everyone is as familiar with. And it's quite rare in the general population, like more common for people with bipolar disorder, particularly for bipolar 1 disorder. So if you have had an experience of psychosis before, then it's a higher chance to have it after pregnancy. And with that, it's an experience of losing touch with reality. But often the part about postpartum psychosis that's a little different than regular psychosis is that it's actually very manic in nature. So there's some sort of discussion in the literature about what the best name for it is, and so it's often that actually can frequently be a person's first experience of mania is in the postpartum after giving birth. So I wanted to tell you a little bit more about some of the tools that we know that can be really helpful and protective for mental health. And the way that we talk about that in genetic counseling, which is also related to that, what is the chance of having an episode? That's connected to what we know about the causes of bipolar disorder. And so what we know about the causes of bipolar disorder is that everybody has some vulnerability, some genetic vulnerability to having bipolar disorder. And not everyone realizes that, but it's really all of us have that genetic vulnerability. It's just a different amount that different people have. And what we talk about in genetic counseling is a mental illness jar. And so in the jar, there's some genetic risk factors that we talk about as having little balls that are genetic factors that are in the bottom, and everyone has a different amount that's filling up the jar to different amounts. And then over the course of our lives, we have stressful life experiences. And those are added into our jars, and they're little triangles that are adding up to getting to that full jar. And it's if you get to a place of having a full jar, then you have an episode of a mental illness. And if it's an episode of mania, then that triggers a diagnosis of bipolar disorder or hypomania. And so what we know, though, is there are things you can do to take out some of those environmental factors, some of those life stressors, to get back to a place where you're mentally well. And there's also things that we can do to add protection to our mental health. So you can add rings on top of the jar to make the jar taller, so that it would take more stress before you're actually experiencing an episode. And so some of the things for trying to take those factors out of our jars can be anything that reduces stress in your life. So, taking a little bit of a break from work, developing more coping strategies. So cognitive behavioral therapy or other kinds of talk therapies can help with that. There's other things that can reduce stress in your life, like perhaps addressing some relationships that are unhealthy for you. Like really, it looks different for everyone. And then protective factors that we know about include things like making sure to pay attention to our sleep, and having really good nutrition, exercise, and social support is really helpful. And for some people, medication is an important part of that picture too. It can make it easier to take out stressful things from your jar, so it can kind of help in that process. And then maybe later down the line, you don't need them anymore. But for other people, maybe it's an important part of preventing future episodes as well. And I'll maybe pass it back to Keri for her to share a little bit more about her experience with genetic counseling and with what's been helpful with your mental health.
That's such a lovely analogy, and I guess so I didn't mention I have bipolar 1, so it's always been mania followed by depression. Right from the age of 16, I signed up for all the studies. So I thought, let's figure this out. And if I have to volunteer in studies, I'll do that. And so I'd been in a couple studies, but I was in the genetic counseling study with Catriona, and that's how I first met Catriona. She was my genetic counselor. And I feel like I really, really benefited from that genetic counseling. And correct me if I'm wrong, because it was a long time ago, but I recall being told that there are these identical twin studies, and where one, if someone has cystic fibrosis, the identical twin will have it 100% of the time. So it's considered purely genetic, this disease. Whereas bipolar, in identical twin studies, where one twin has it, the other twin will have it 70% of the time. And so they've taken from that there are environmental factors that influence it. It's genetic. There are genetic components, but there are environmental factors that influence it. So in my genetic counseling, I learned that about more or less, I don't think there was the jar analogy, but more or less the protective factors, including getting good sleep, exercise, nutrition, And I took that to heart and really incorporated that into my whole life and my lifestyle. And I feel like that's really, really helped a lot. I can't remember when that study was, though.
You're right on, Keri, about the twin studies, and really really nicely said. Yeah, that it was a long time ago. It was let's see, I think it was 2009, I think. So maybe 12 years ago now. Yeah, I also wanted to mention that there's a nice acronym for capturing some of those protective factors that I particularly like for the perinatal period, which is NESTs. So N stands for nutrition, E for exercise, S for sleep, T is for time for yourself, and the second S is for social support. And, those things are, I mean, they're really actually quite challenging to do. It sounds kind of simple and basic, but you really actually have to work pretty hard at it. Like I know for myself, I'm very aware of trying to make sure that I'm rigorous about my sleep hygiene, and it takes a lot to meal plan and get all of that together to have good nutrition. And I'm really lucky that my husband is the chef in our house, and so he takes care of pretty much all of that. I'm the sous chef. I do some chopping of vegetables. I just wanted to acknowledge that there's actually quite a lot that goes into that, and I think it's really wonderful when people are able to implement that in their lives.
And those are the core pillars of self-management and bipolar disorder more broadly. But I would imagine there's nothing quite like a baby that can upset the balance you have between self-care activities and sleep. But we know that these things are very, very strong threads for wellness and episode prevention in bipolar disorder.
Absolutely. And that's the thing, is that, yeah, I mean, adding a baby or two in there is, I mean, yeah, for sleep, oh my goodness, there's so much disruption there. And then, that's what it makes such a difference to have support around you to, with nutrition. Like when I had my first son, oh, we got so many wonderful like food packages just delivered to our door, and it was so appreciaed. And like, with sleep, for my husband and I, we traded off shifts so that fortunately we had babies who liked bottles, and not all babies do, but ours did. And so we were able to, my husband was able to do some of the feeding, and that let me have more sleep, which I think is makes such a difference. It also makes a difference because it means that the burden of that is not entirely on you. I really feel for the moms or the chest feeders that are kind of on their own with that, and that don't have the use of the bottle to help. One other thing I just wanted to pick up on from your story, Keri, was the fear around the risk of the episode in the postpartum. And I'm sorry, I can't remember if you said it here or I just know it from before, but I believe you'd said that the psychiatrist had mentioned that you'd have to be separated from your babies if you had to go into the hospital. And that's something that is the case right now in Canada, that for women experiencing severe postpartum depression or postpartum psychosis, who feel like it's important for their health to be hospitalized, that they are separated from their babies, and that's something that that I think is a really something I'd like to see change. And for my fellowship that I just got funding for, I am going to be focused on that and on coming up with ways that we can better support women and families who are facing severe episodes in the postpartum. And as part of that, I'm including an expert advisory group. So, you know, if there are any audience members who also feel passionately about this and, you know, want to be involved, then, you know, I'd love to hear from you.
Yeah, that I didn't mention it just now, but that definitely added a great deal to my fear. The psychiatrist told me that, yeah, if I did develop psychosis immediately after birth, that I would be separated from my children. And yeah, that was, I mean, that was in the same appointment where I'd been given the other figures, about 50 to 100%. So I left that appointment in tears, but gradually got my confidence back with all the supports I had in place. Yeah, I feel strongly that mothers should be kept together with their infants, no matter what. I work with a lot of people with substance use, problematic substance use, and having babies, and they're also often separated from their infants, and I think that creates lasting damage. And I think there is a way to support people through that, and I think our children would benefit from staying with their mother and father.
Absolutely. And other countries around the world do have parent-infant units and different models of care that involve, you know, supporting the whole family together. And so I'd love to see something like that here. I'm just noticing the time, and I wonder if we might shift.
We have a lot of questions coming in. Are you ready to move on? I was just trying to keep an eye on them as we were going through. Actually, there's one that is actually asking you to dive in a bit deeper around the postpartum psychosis bit. So maybe we should start with that one. This participant asks from Facebook, by postpartum psychosis, do you mean mania? Can you just clarify that a little bit again, Catriona?
Yeah, for sure. It is a bit confusing. So it's actually a unique diagnosis that is particular to the postpartum period, that it looks a lot like mania, but it does also have the features of psychosis. So mania with psychosis, basically. And it can look different for everyone, like as kind of all episodes would. So each person can experience it a little bit differently, but you know, it's a melding of both of those things usually.
Thank you. Okay, let's move on with some questions, if that's okay. First one that came in before this webinar: can pregnancy trigger bipolar disorder? And if so, what can be done to reduce the chances that I'm going to develop bipolar disorder? Just to be clear, I don't have it myself, but I have a really heavy family history.
Yeah, maybe I'll start off with taking that one. And you know, if you have anything to add, Keri, please do. But I wanted to first off just say that I actually have that same experience. My sister has bipolar disorder, and I have recurrent depression and panic disorder, and it's something I was very anxious about when I decided to get pregnant, and I was I was worried about being one of the people who had a first episode of mania in the postpartum, and thankfully that didn't happen. And I think partly it was potentially because I'd put into place a lot of the factors that I talked about for trying to protect my mental health. So I'm hoping that what we've already talked about kind of addressed that piece of the question. but just to kind of summarize or touch back into it. So yes, it can trigger bipolar disorder. And the things that you can do to try to prevent that are things like creating a plan for how you're going to have support in the postpartum. So, you know, are you able to rely on your family? Or on the other hand, is your family really stressful and are there boundaries that you can put in place beforehand around expectations around visiting? Because sometimes that's actually more stressful. And so maybe there's ways that you can set up expectations in advance and really set those boundaries for yourself. And on the other hand, maybe there are friends that could be involved and be more hands-on. Thankfully, now that the pandemic restrictions are easing, that's going to get a little bit easier. I think that was a real challenge during this pandemic, the postpartum period, just because there's such so many barriers to having that hands-on support. But yeah, and then asking people to bring food. I think don't be shy. Like, a lot of people really want to do something. And dropping off food is a really nice way for people to contribute and support you. And then for me, just as something else to add, I have a meditation practice that I started many years ago now that I find really helpful. And it's something that what I did for myself is just sort of lowered my expectations in what I would be able to accomplish, but being able to just say, you know, even taking 5 minutes or something like that was still helpful for me. Yeah, I think I covered all the pieces of that question. Did I forget anything?
I don't think so. I would just add that incorporating these protective factors, I think all pregnant women should do it. And I don't know the stats for postpartum depression, but I would imagine that it would be a preventative for that as well. And I, like I mentioned, had a lot of supports, including my best friend did a meal train for me, and I had 3 months of meals, 3 months solid of meals from family, friends, and neighbors. And it was so incredible. And then I also had a neighbor, or I guess family friend, who offered to come a couple days a week. Initially, she said, I love babies. I'll even clean your toilets. And I'm like, you don't have to clean my toilets. She came twice a week and would just take them for 5 hours twice a week. And I mean, the other pieces, I was really successful with breastfeeding, and apparently there's an oxytocin release with breastfeeding. So I think that can be another protective factor. And so, and I was doing twins, so I was getting probably even more oxytocin.
Keri, what did you do with the gift of those 5 hours twice a week? How did you use all that gift of time?
I think I got some rest, and I probably got some chores done.
Beautiful. I love that you guys had the privilege of community shouldering in around you to support you. It's heartwarming. Go on, Keri, sorry.
Just one last thing. I was living in a communal house at the time, and so there were a lot of people around. And I remember as they got a bit older, one of them complaining and saying, just clean as you go, like clean after your children. And I'm like, if that was what I was doing, that's all I would be doing. Sorry, you're gonna have to live with a bit of mess.
A bit utopian, huh? Let's move on to another question. I love this question. I'm really interested to see what you make of it. Is it a myth that pregnancy can cure bipolar disorder? I stopped taking my meds when I found out I was pregnant. I've been med-free for 2 years now. I know that no professionals will encourage me to stay off my meds, but is there an actual explanation or theory about this?
Yeah, thank you so much for the question. And first of all, I'm really glad to hear that that you've been well for a couple of years now. It's fantastic, and that stopping your medication, it went smoothly, and you didn't have any episodes in the postpartum. That's really great. And as you heard from Keri, it's we know there are lots of examples of people who are able to do that. And in terms of the literature, I'm aware of some that have found some lower risk for an episode during pregnancy, but generally speaking, there's the higher chance to have episodes in the postpartum. And at the moment, unfortunately, we have no way of really predicting who's going to be the one that develops an episode in the postpartum. I think we can speculate in terms of like, if the more of that support that you have, the lower the chance would be. And I think there's people who are at higher risk, especially if they're really isolated, and if there's also a lot of other societal pressures that they're facing that are unsupported with. But in terms of a cure, I would be very hesitant to use that term. And I think it would still be important to continue to just keep an eye out for any signs of any symptoms recurring. And just to be aware, and if you have a partner or families or friends that are also kind of keeping an eye out for that, that can help head anything off if it does start to kind of ramp up, then I think that's all you need to do, in a line with continuing all those self-care strategies. But yeah, no, I think there's a lot more research that needs to be done to understand the impact of hormones and changes around pregnancy and how that impacts mental health.
I would just be curious to know how many, like, if you incorporated those protective factors into your own experience, and if that was helpful in the 2 years so far.
Mm-hmm.
Yeah, good point, Keri. Lots of questions coming in. Can we carry on? Do you both know what a emetophobia is? I had to look it up just now. It's a fear of vomiting.
Fear
of vomiting. I wasn't sure if I was remembering it right. So this participant is somebody living with bipolar disorder type 2. They're on several medications. She's received advice about meds, so she knows she can stay on them, but she's got severe anxiety and emetophobia and doesn't know how to manage that without taking too much Ativan. So she's really worried about managing these anxiety symptoms and pregnancy, and just the taking of the medication during that process.
Yeah, no, and I can imagine anxiety about pregnancy and worrying about throwing up as part of that. Actually, for just as on that note, in my experience, I actually didn't throw up in pregnancy. I did have a little bit of nausea, but it's just all. I know I'm only one person, but just to sort of say it's not a given that you would. But it's certainly natural to feel anxious about that, especially if you have a phobia around that already. And I also, given my experience of panic disorder, I know how, or at least I have felt a lot of relief from Ativan, and from having it actually is part of what's really helpful for me, is just knowing it's there and knowing that it does help. And so that, if I really need it, then I can have it. I don't know if that helps you in the same way. So it sounds like you might have already had a consultation with either a member of the reproductive mental health team, or possibly a genetic counselor. Can also speak to some of the medication use in pregnancy points. I think I heard right in that question that you've said that you know that it is okay to keep taking them, but it sounds like maybe you're still holding on to a little bit of anxiety about going ahead with taking them in pregnancy. Yeah, Erin's nodding. Okay, good. Yeah, I understand. I actually took my medications during pregnancy, and it was a tough decision. That was partly what motivated me in my PhD research, and it's something I heard from everyone that I interviewed was the pressure not to take any medications in pregnancy. It's very strong. You know, society tells you that a good mother doesn't take medications in pregnancy. And so there's a lot of guilt and anxiety about that. Fortunately, I have a lot of privilege, and you know, as I mentioned, I have a really supportive partner. And you know, one of the women I interviewed in my study had said that when she was considering taking medications in her pregnancy, she felt that she had to have a conversation with her partner about, you know, would he be okay with you know, having a partner who is taking medications in pregnancy. And fortunately, he said yes. But I think that just speaks to the fear and the anticipated judgment that that people have in thinking like, you know, maybe my partner wouldn't want to be with me anymore if I did. And
I'd love to know, Catriona, if that was something that Keri experienced too, that fear of judgment. It sounds like you had a lot of support, but did this sort of stigma and expectations of society come up for you in your personal experience as well?
No, not for me. I think because I had so much support. I mean, when I left that appointment in tears, I met with my spouse, and he was so supportive, and he said, "We'll get through this." And yeah, he supported me in my decision. But one thing I just wanted to mention is the psychiatrist I saw told me that a manic episode would happen immediately following birth. And I don't know how immediate, but I'm thinking within the first day or two. And so she agreed that I should stay in the hospital an extra couple of days. So that was reassuring, just to know, to have that added kind of safety.
Yeah, and just to add to that, it's definitely nice to feel like, you know, having that extra support for staying a little longer in the hospital. And it is most common that it would occur like really quickly after delivery. It can be up to 4 weeks or 4 to 6 weeks, but more commonly within the first week.
Thank you both. Let's try and squeeze in a couple more questions before we go to the resources, if we can find the time. This is from a mom of 2 boys with bipolar disorder. Her experience was that she actually blamed her parents for bringing her into this world with bipolar disorder. She then moved on from that judgment and blame, but now, interestingly, she's experiencing feeling burdened by the idea that her children are going to blame her if they develop bipolar disorder one day. It's almost like this kind of like familial passing on of shame and blame and self-stigma. And do you have any thoughts or tips for her?
Did you want to start with that one, Keri, or shall I?
I can talk a little bit about my own experience, and I felt the need to blame as well initially, but I also felt like, as unpleasant as my hospitalizations were, they were also huge growth experiences for me. I met some amazing people in the hospital, and when I say amazing, I'm referring to the patients. They were just such like lovely, resilient, and open people, and when they were there, and yeah, I feel like that's actually guided the direction I've taken in life. So, as negative as the hospitalizations and all the episodes were, I definitely gained out from them. And my boys are 8.5, and they know a little bit about it. I've talked a bit about it. I'm sure they'll ask me more as they get older. And I think what I'll just instill in them is these protective factors, and also that, you know, if you do have an episode, we can get through them, and it's not the end of the world. And for me, it's actually shaped my life in a good way.
I think that's beautiful, Keri. And I just wanted to add, you know, kind of listening to the question, this made me think about, you know, how the person who was asking the question was able to process those feelings, you know, with respect to their own parents, and thinking, you know, like have the hope that if it were to come to pass that, you know, their children felt that way towards them, that they would also be able to work through it and come out the other end as well. But I think it's really important, everything that Keri said, that you know, if you're able to I think in many ways, people who have experience with, particularly with managing mental illness well, you're actually you have a big advantage in supporting your kids to be mentally healthy, because you're really aware of all of these things and what they look like. Like, I'm thinking of my mom when my sister started experiencing bipolar disorder. She had no idea, like, well, none of us did, and it was, you know, completely out of the blue, and you know, you're kind of helpless. Whereas, you know, as Keri says, like, now that once you've been through it, you know that you can get through it, and some of the ways that you can get through it.
I love the way you positioned that from a place of strength and resiliency. Really, really nice input, both of you. Thanks. Probably one more question. This is on diet when pregnant with bipolar disorder. And specifically, it's asking about, you know, lack of interest in food during depression, lack of ability to cook nutritious, good food. This person also has food allergies, so it's really hard for them to eat well. And conflicting information about what foods are safe to eat. You got any thoughts?
You know, this makes me think of a conversation that we were just having before this talkBD event started, which was just how important nutrition is, but how little we actually understand in terms of what the factors are that that are important and how to get that nutrition. And although I'm sure if there are any dietitians in the audience, maybe they would disagree with me, but I guess, you know, there's prenatal vitamins that are really helpful, that are, you know, a way to hopefully get some of that needed nutrition without having to do a lot of meal prep. And I mean, not to say that that's enough, but just to take some comfort in that, if you're able to take those. Then you are getting some of those really important vitamins for yourself and for your developing baby. And I think, you know, I can understand feeling a lot of pressure, because I think there's a great deal of scrutiny in pregnancy on what you eat as well. You know, there's so much, I feel like society has judgment on so many things, and you're under a microscope, and especially at the point when it starts to become obvious that you're pregnant, then it starts to feel a little bit like your public property, like everyone has the right to comment on, you know, the choices that you make and the things that you do, and to tell you how to have a healthy baby, or how, you know, the things that you're doing that are problematic. For myself, I remember strongly going for brunch when I was pregnant the first time with my husband, and just saying, you know, F it. And I had, you know, an eggs Benedict that was soft boiled. So I was like, I'm just going to have my eggs the way that I like them. And I had, you know, like some raw salmon in there, and it had like tequila sauce that was, you know, as part of the sauce, and I was just like, you know what, I'm gonna have the food that I want to have, and I know that I'm not going to do anything that I think is likely to be harmful, but I'm also not going to be, you know, rigid about policing, you know, my food intake. So I feel like if you can get up the energy to have like a, you know, deli meat sandwich, have the deli meat sandwich.
Keri.
I would just quickly add, I learned my last episode where I was hospitalized, around that time I was having a very loud stomach noise, and learned that I have like a gluten intolerance, possibly celiac. So I've been off gluten for quite many years. And then with having children, I became very interested in nutrition for my children's sake. So I feel like there's a lot of information now about gut health. And so I've incorporated that into my diet. So fermented foods, I make kefir. I read labels to see how much sugar is in a lot of this stuff. So my diet's definitely improved, but I would say if you have like a baby shower, I would go for like getting people to contribute to, are they called food doulas? There are people that will actually deliver nutritious food to your home. And the meal trains, you can specify your dietary restrictions. Yeah, so some good options out there.
Nice concrete tips. Thank you. I'm going to take 5 minutes to run through a few resources and slides, but I'm going to leave you both with one last question, and we're going to come round to it right at the end when we close. So you're going to have about 5 minutes to think about your answer to this, and you're going to need to be brief because we've got like 7 or 8 minutes left. And the question is from somebody who's living with bipolar disorder type 2, they're planning their first pregnancy, read lots on websites, but still super worried. What they want is your personal top 3 tips for things to do or things to look out for. So I'll let you cogitate, Keri, Catriona, on that, and then pop over to a few resources and tools for you. This is an excellent website, the BC Reproductive Mental Health website, where you can get resources and tools. So we encourage you to check that one out. It will be in your resources package as well with the website link provided. And Catriona, I think we should have a whole separate session on genetic counselling and what it does specifically. We'd love to do that at some point, but the work of the BC Adapt Clinic is just stellar. And if you're in British Columbia, you can actually self-refer to this service, which is rare in itself. Really encourage you to check out this specifically if you're in our geography, but genetic counselling more broadly is a fantastic resource, and I'm sure Catriona can help segue you into regional resources and tools and organisations. So get in touch with us if you'd like more details there. As usual, our Bipolar Wellness Centre is our home for curating the most evidence-informed self-management strategies for bipolar disorder that we have. And then the quality of life tool is specific for people with bipolar disorder and measures quality of life in a variety of life areas over time. There's an online version of that, as well as a more classic paper and pencil version. And this is our academic website. This is where you sign up for our newsletters, keep in touch with what we're doing, request currents, and happily we're already scheduling into the fall. And also I think we're looking pretty good for funding for talkBD right the way through 2022 with a live component, finally, not just online, but also live. Scheduling into the fall, we have Dr. Greg Murray talking about circadian rhythms and routines in bipolar disorder on September 23rd. And then Dr. Stephen Barnes, accompanied by a student who lives with bipolar disorder, will be talking about education and thriving in school on October 7th. And then November, I think we're going to do one on psychedelics, psilocybin or magic mushrooms in particular. So I think that one will generate a bit of interest. So those are coming events. You can see all of the previous talkBD live events through our website. Submit your questions or ideas for other events that you'd like to have, or just access them direct through YouTube. And one of the things we've been doing recently is creating little snippets from these events as well, little nuggets. And then finally, please do answer our 3 or 4 questions that we have just around evaluating this and what's working well for you and what isn't, if you have the time. Thanks to our funders and supporters. And this is how you get in touch with us. And I'm going to round back out with 4 minutes to go for our 3 top tips from you both personally for thriving during pregnancy and postpartum when you live with bipolar disorder.
I'll let you go first, Keri.
Okay. I guess the first one would be to have a lot of support in place. I don't know if the saying is quite right, expect the best, prepare for the worst. But having supports in place, and then even if the best happens, you have those supports that make it an even better experience. Sleep and nutrition, I guess, would be 2 and 3, if you can figure out a way to help that and incorporate self-care into all of that.
Awesome. I'll try to also be very brief. I echo everything Keri said. One way that I've heard a lot of participants talk about it and resonates for me is it takes a village. And you know, that just speaks to that point about social support and having supports in place. And that's a piece that sort of connects to a sort of a second point, which is, you know, in terms of the medications, you know, we just wanted to make the point that if you are thinking of stopping medications or tapering down, then that's, you know, really, it really is important to consider the supports that you have in place and to make sure that you're doing that from a place of wellness and you know, with the support of your care team. And I mean care team broadly, including partner, family, friends, as well as healthcare providers. And then thirdly, just from my own personal experience, the biggest thing for me was having my partner being able to do some of the feeding so that I was able to have more sleep and to feel like I wasn't, like my husband said to me, you know, like we're in this together. And that was really, really powerful for me.
Beautiful, thoughtful responses, both of you. Thank you. Thank you, Keri. Thank you, Catriona, for your time, sharing your expertise today. And thanks in particular for all the wonderful questions we got from our attendees and people who joined us. Look forward to seeing you in the fall. If you're in our hemisphere, enjoy the summer and get some downtime if you can. And we'll look forward to coming back together in September. Take care, everybody. Thank you. Thank you.